You are sitting in a meeting. A senior colleague asks you a question in front of 30 people. You do not know the answer. You feel it before you think it. Rising. Unstoppable. Your face betrays you before your mouth ever opens. Why does the body do this? And why, despite every evolutionary pressure towards social concealment, has it not been selected away? Because it is not a flaw. It is a feature. Today we are going to go deep, neurobiologically, evolutionarily, clinically, into the most underestimated emotion in the human social repertoire. This is a script about embarrassment, about blushing, about why your involuntary honesty signal may be the single most sophisticated trust mechanism your body possesses. Let us begin with definitional precision because embarrassment is routinely conflated with shame, guilt, and humiliation, and conflating them produces clinical errors. In the psychological literature, embarrassment is classified as a self-conscious emotion, a category that also includes pride, shame, and guilt. What distinguishes self-conscious emotions from basic emotions like fear or anger is that they require self-awareness. You cannot be embarrassed without a concept of self, and you cannot be embarrassed without a theory of how others are perceiving that self. June Price Tangney, one of the foremost researchers on self-conscious emotions, distinguishes embarrassment from shame on a critical axis. Shame involves a global negative evaluation of the self, I am bad, whereas embarrassment involves a more bounded, situational exposure, I have been seen doing something that violates a social norm and I care that I have been seen. This distinction is not semantic. It is clinical. Shame correlates with psychopathology. Embarrassment, properly understood, does not. So ask yourself, when was the last time you experienced something you labeled as shame, and could it actually have been embarrassment? What is the clinical cost of that mislabeling? Embarrassment has a well-documented three-component structure that distinguishes it from adjacent emotional states. First, the phenomenological component. The subjective felt sense of unwanted social exposure. The internal experience of being seen in a way you did not sanction. Second, the behavioral component. Gaze aversion. Nervous smiling. Covering the face. Turning the body away from the gaze source. These behaviors have been documented cross-culturally, suggesting a deep phylogenetic origin. Third, the physiological component. And this is where blushing enters. Cutaneous vasodilation, the dilation of blood vessels in the face, neck, and ears, triggered by the activation of the sympathetic nervous system, mediated specifically by the release of adrenaline acting on beta-adrenergic receptors in the facial vasculature. Note the paradox already embedded in this structure. The sympathetic nervous system, the fight-or-flight system, is activating not to help you escape a predator, but to help you communicate a social state to other humans. Evolution repurposed the machinery of survival for social signaling. Let us trace the neurological pathway with specificity. A social transgression is perceived, real or imagined. The anterior cingulate cortex, which monitors conflict and social error, signals disruption. This activates the amygdala, which assigns threat salience. The hypothalamus receives the signal and activates the sympathetic branch of the autonomic nervous system via the thoracic sympathetic ganglia, specifically the stellate ganglion and the superior cervical ganglion, which innervate the facial vasculature. Adrenaline is released. In most vascular beds, adrenaline causes vasoconstriction via alpha-adrenergic receptors. But in facial blood vessels, particularly the vessels of the cheeks, ears, and neck, there is a uniquely high density of beta-adrenergic receptors, which respond to adrenaline by causing vasodilation. The result, blood floods the face. The characteristic red or pink flush appears. Skin temperature rises measurably, by as much as 1 to 2 degrees Celsius in some studies. Here is what is remarkable, you cannot fake this. You cannot produce it voluntarily. And critically, you cannot suppress it no matter how hard you try. In fact, the research of Ray Crozier at Cardiff University showed that conscious attempts to suppress blushing frequently intensify it, because the cognitive effort of suppression itself creates additional arousal. The involuntary quality is not incidental. It is the entire point. Here is something that should arrest the attention of every clinician and researcher in this field. The prefrontal cortex, the seat of executive function, conscious regulation, deception, and social performance, has no direct down-regulatory pathway to the facial vasodilatory response in the context of embarrassment-evoked blushing. Let me say that more plainly, the most sophisticated part of your brain, the part responsible for lying, for impression management, for crafting social personas, cannot stop your face from blushing. What does that mean for a signal theory of embarrassment? It means that blushing is, uniquely among human social signals, outside the architecture of deliberate control. It cannot be simulated by actors. It cannot be reliably suppressed by executives under pressure. It cannot be masked by sociopathy because the sociopathic deficit is precisely in the social cognition circuits. But the blush mechanism is downstream of that, in the autonomic system. The blush is the only human social signal that cannot be faked. The question that should trouble any evolutionary psychologist is this: why does blushing still exist? If blushing signals social error and social error reduces status, then blushing should be selected against. Individuals who blush should be disadvantaged. They should lose social standing, resources, and reproductive opportunity. Over evolutionary time, blushing should have been reduced or eliminated. But it has not. In fact, it appears to be conserved across all human populations, present in every culture, every ethnicity, modified in expression by skin pigmentation but neurologically and physiologically identical. What is blushing doing for the blusher? The most parsimonious evolutionary explanation comes from the work of Mark Leary at Duke University and Peter de Jong at Groningen. They propose that blushing functions as an appeasement signal, a biological mechanism for rapid social repair. In group-living primates, social transgressions are inevitable. They are also dangerous. In the ancestral environment, being expelled from the group was equivalent to a death sentence. Therefore, the ability to rapidly signal remorse, awareness, and submission after a transgression would have been enormously adaptive. Blushing does exactly this. It communicates instantaneously and credibly 4 distinct pieces of information to observers. 1. I know I violated a norm. Blushing is proof of social awareness. 2. I care that I violated it. Blushing is proof of group valuation. 3. I am not attempting to deceive you about my awareness. The involuntary quality is proof of honesty. 4. I am in a state of social vulnerability right now. The physiological exposure is proof of openness. This 4-part signal package is extraordinarily difficult to replicate through deliberate action. And it functions automatically, in real time, at the exact moment it is socially most needed. Dr. Keltner and colleagues at Berkeley provided empirical grounding for this theory through a series of studies on embarrassment, appeasement, and social judgment. In one paradigm, participants who displayed embarrassment responses, including visible blushing, gaze aversion, and appeasement smiling, following a social transgression were rated by observers as more trustworthy, more likable, and more pro-social than participants who showed no embarrassment response. More striking, observers were more willing to enter into cooperative relationships with individuals who had blushed following a mistake than with individuals who appeared unaffected. Think about the clinical implication of that finding. What does it mean for how we counsel clients who present with erythrophobia, a pathological fear of blushing? Are we inadvertently treating an adaptive signal as a symptom? In evolutionary biology and economics, costly signaling theory provides the framework for understanding why reliable communication evolves between agents who might otherwise have incentives to deceive each other. The core principle is this: a signal is credible precisely because it is costly to produce, difficult to fake, and therefore cannot be manufactured without the underlying state it purports to signal. The peacock's tail is the standard example. It is metabolically expensive, structurally cumbersome, and dangerous in the presence of predators. No low-quality peacock can afford to produce it. Therefore, it reliably indexes genetic quality. Blushing is a costly signal in the same formal sense. It costs social standing in the immediate moment. It reveals vulnerability. It cannot be faked by actors or suppressed by those who wish to conceal their transgression awareness. Its very cost, the social exposure, is what makes it credible. And because it is credible, because observers know it cannot be simulated, it functions as an extraordinarily potent trust signal. Thomas Gilovich and colleagues at Cornell documented what they called the illusion of transparency, the systematic overestimation by individuals of how much their internal states are visible to observers. People who blush believe, acutely, that their embarrassment is far more visible and far more negatively evaluated than it actually is. But here is the irony that the research reveals. Even when observers do notice the blush, even when they do perceive the embarrassment, their evaluation is typically positive. Not contemptuous, not dismissive, warmer, more trusting. The person blushing is convinced they are being judged. They are in fact being trusted. What are the clinical implications of this inversion? For patients with social anxiety disorder who typically overestimate negative evaluation, what happens when you show them this data? When you tell them that the thing they most fear revealing is the thing observers most reward? We live in an age of calibrated self-presentation. Social media allows individuals to curate identities with unprecedented precision. Political and corporate communication is professionally managed to eliminate any signal of uncertainty or vulnerability. In this context, the involuntary, unmanageable, unglamorous blush carries a remarkable social weight. It is irrefutable proof of authenticity. When a politician blushes, we notice. When a CEO blushes in a difficult press conference, we update toward trust. When a clinician blushes, and yes, this is documented in the clinical supervision literature, patients frequently report feeling more connected, more understood, more safe. The blush communicates, I am genuinely affected. I'm not performing effect. My engagement is real. Slow beat. Then continue. If blushing is an adaptive signal, why does pathological fear of blushing, erythrophobia, exist, and why is it so disabling? Erythrophobia is defined as a persistent, excessive, and distressing fear of blushing in social situations. It is classified within social anxiety disorder in DSM-5, though some clinicians argue it warrants its own nosological status given its distinct phenomenology and treatment profile. The prevalence estimates range from 1 to 7% of the population, with higher rates in clinical samples. It is associated with significant occupational impairment, avoidance behavior, and quality of life reduction. The cognitive model, developed by Clark and Wells and adapted specifically for erythrophobia by Paul Drummond, posits a characteristic self-reinforcing loop. Social situation encountered anticipatory anxiety, physiological arousal, blushing begins or is anticipated, attention shifts to internal monitoring of blushed, catastrophic cognitions about observer evaluation, increased arousal, intensified blushing, behavioral avoidance, short-term relief, long-term strengthening of the fear network. Notice where the loop breaks if you intervene at the cognitive evaluation level. What happens to the entire cycle if the patient genuinely, not intellectually but effectively, integrates the evidence that observers evaluate blushers positively? There is a particularly cruel paradox at the heart of erythrophobia, and it is neurobiologically grounded. The developmental function of embarrassment is to repair social bonds. In a securely attached developmental environment, the child's social transgressions are met with parental responses that are warm, proportionate, and repair-oriented. The embarrassment signal functions as it is supposed to. Transgression occurs, embarrassment signals remorse and social awareness, the social bond is repaired, and the child learns that the signal is effective. In insecurely attached environments, particularly in families where parental responses to transgression are disproportionate, shaming, or rejecting, the child learns something different, that the embarrassment signal does not produce repair, it produces escalation. The signal that should terminate the threat ends up amplifying it. In this framework, erythrophobia may be partly understood as a learned catastrophization of an adaptive signal, rooted in early attachment experiences that disrupted the normal signal repair cycle. This has implications for treatment. If erythrophobia is partly an attachment-mediated catastrophization, then purely cognitive or physiological interventions may be insufficient. The therapeutic relationship itself, as a corrective relational experience in which the signal is received non-catastrophically, may be a central mechanism of change. Embarrassment is not merely an interpersonal phenomenon. It operates within organizational and institutional contexts with significant consequences for group function, leadership, and culture. Research on organizational behavior consistently shows that cultures in which embarrassment is punished, in which admitting error produces social consequences so severe that individuals learn to conceal rather than disclose, develop systematic deficits in learning, adaptability, and psychological safety. Amy Edmondson's work on psychological safety at Harvard directly addresses this. Teams with high psychological safety, in which members feel safe to raise concerns, admit errors, and express vulnerability, consistently outperform teams with low psychological safety on learning outcomes, error recovery, and innovation metrics. The mechanism is essentially this. Psychological safety is the organizational condition that allows the embarrassment signal to function. When the signal can be expressed without catastrophic social consequence, it can do its job, communicating error awareness, initiating repair, and restoring relational integrity. When organizations systematically punish the signal, when leaders treat visible vulnerability as incompetence, they do not eliminate the underlying social cognition. They suppress the signal. And suppressed signals create the conditions for catastrophic delayed disclosures, whistleblowing crises, and the kind of institutional failures we see repeatedly in high-consequence industries. If you are working with organizational clients, consider, is your client's culture producing erythrophobia at an institutional level, pathologizing the very signal that would allow it to function? The therapeutic frame creates unique conditions for embarrassment, and the literature on therapeutic rupture and repair is directly relevant here. Clients frequently experience embarrassment in session, about disclosures, about emotional reactions, about dependency needs. The therapist's response to visible client embarrassment is a critical relational moment. Research by Jeremy Safran on therapeutic alliance ruptures suggests that ruptures frequently occur around moments of client shame and embarrassment, and that the quality of the therapist's response at that moment is predictive of both repair and therapeutic outcome. A response that normalizes, validates, and implicitly rewards the client's willingness to remain present in a moment of social exposure reinforces the adaptive function of the signal. A response that minimizes, reframes away, or subtly mirrors the client's own catastrophization of the experience can deepen the pathological relationship to the signal. The therapist who blushes in response to a client's unexpected disclosure, and we know this occurs, is providing involuntarily a parallel process message. I am also affected. I am also present. I am also operating honestly within this relational space. Let us consolidate the argument and bring it to its clinical conclusion. The standard clinical narrative around blushing and erythrophobia is organized around reduction. Reduce the blushing, reduce the anxiety, reduce the avoidance, reduce the distress. And reduction of pathological distress is of course a legitimate therapeutic goal. But there is a more precise intervention available, one that addresses not the signal itself, but the meaning architecture surrounding it. The signal is not the problem. The signal is evolutionarily conserved, neurobiologically adaptive, socially functional, and by the empirical evidence of multiple independent research programs, positively evaluated by observers. The problem is the relationship to the signal. The problem is the catastrophic meaning assigned to an involuntary biological event. The problem is the suppression loop, the avoidance architecture, the social withdrawal that prevents the signal from completing its adaptive function. The therapeutic question then is not, how do we stop this patient from blushing? The therapeutic question is, what would it take for this patient to be someone who blushes and knows it is not a catastrophe? That is a meaningfully different treatment target, and it has meaningfully different implications for intervention design. Here is the intervention I want to leave with you. When a client presents with erythrophobia, or with shame about their emotional visibility, or with the conviction that their involuntary responses to social situations are weaknesses that betray and humiliate them, consider this reframe. What if you are the most honest person in the room? What if your body is doing something that most people's bodies cannot do, signaling involuntarily, credibly, and in real time that you know the social rules, that you care about the people around you, and that you are not deceiving anyone about your inner state? What if the thing you are most ashamed of is the thing that makes you most trustworthy? What if the weakness is actually the signal? Let us close with the full structural argument stated precisely. Embarrassment is a self-conscious emotion requiring self-awareness and theory of mind. It is neurobiologically distinct from shame, guilt, and humiliation.